Question number 1. I'm turning 65 soon, and I've paid a lot for insurance over the years. Now, I know there's plans available that have no premium, but there's also ones with premiums that are over $100 a month. What's the difference, and can I keep my doctor? So, basically what this person is asking me is, should I get a Medicare Supplement plan or should I get a Medicare Advantage plan? Some people also have insurance from their employer available to them, but we don't kind of deal with that. If there's insurance from the employer available to you, you should definitely look in that and see if that is an option available to you, if the price is right, if the benefits are good. If somebody asks us to take a look at it and compare it to the other options, that's something we'll do as well. But employer insurance is actually very specific to the employer, so there's not a lot that we can do right there. But as far as Advantage plans versus supplements, that definitely is the area that we work with. Here's kind of what they are. A Medicare Supplement does exactly what it's called. A Medicare Supplement is going to supplement Medicare. And what that means is Medicare is going to be primary. It's going to pay its bill. And then whatever Medicare generally, except for some preventative services, Medicare generally leaves some costs associated with it for you to pay. There's a Part B deductible. There's typically 20% of the bill left over after that deductible if it's a Part B charge. If it's a Part A charge, there's specific copays. There's a Part A deductible. It's pushing $1,300 this year going into 2017. So there's actually a lot of costs associated with Medicare beyond just 80/20. But what a supplement does, supplements are organized by letters, and you can see the grid on our site. But what you do is you choose a plan letter. Now the primary plan letters that people choose are F as in Frank, G as in George, and N as in Nancy. And the reason why is they're among the more thorough plans, at least in the states we work in. Now if you're watching this in some other states, there are some other plans that might be a little bit different in terms of cost to benefit ratios. But for the most part, Ohio, West Virginia, Kentucky, F, G, or N are what people generally wind up with in a Medicare supplement. And what those plans do is, in a nutshell, there's a lot more to it than this, but in a nutshell, they just take Medicare's bill that they leave for you and they pay it. Now, the F just basically pays the whole thing. The G opens you up to that Part B deductible that Medicare has, and then it pays the rest of the bill. So it's the same as an F minus the deductible. Why would a person do that? Leaves you with a slightly cheaper premium. The N plan opens you up to a couple of copays plus the deductible, pays the rest of the bill after that. Why does someone do that? Again, it's another way to lower the premium. So F is typically the more expensive when you compare all the plans together. F is the most expensive. G is a little bit less expensive than F. N is a little bit less expensive than G. You more or less wind up with the same product. But the cost, if you're 65 years old, male, non-tobacco user, and you live in Ohio, you're looking around in January 2017, you're looking at about $140 a month on average. There are some that are a little bit less in the 120s. There's some that are well over $200. So you're looking at about $140 a month. But the rest of your bill is paid. With a G plan, you're looking, again, same time, in the state of Ohio, you're looking at about $110, $115, $120 a month. $115, let's say that, for a G plan if you're a male. Women are about $10 less, and if you're a tobacco user, you're going to be paying, on average, about $10 more, regardless of if you're a male or a female. And if you're looking at an N plan, you're looking at between $90 and $100 a month, depending on the company that you choose. So you're looking at, in addition to what Medicare is going to charge, now Medicare has a charge for Part B. You're not going to escape that. Medicare Part B's charge is about $134 a month for 2017. I'm sorry, pausing a little bit because as I'm recording this in the beginning of January of 2017, the numbers did change a little bit from 2016, where it was about $122 a month. This year, it's going to be about $134 a month. If you're over 65, there's a whole complicated reason for why, but the amount that you're paying is actually about $109 a month. So some people, if you're just turning 65, like the person who asked this question and going on to Medicare, your rate is going to be about $134 a month. Yes, it's more than other people who've been on Medicare for a few years. There's a reason for that. Maybe I'll get into that later, but right now, just know it's $134 a month. The Medicare Supplement is going to be an additional $100 plus a month. So if you're an N, it's going to be an additional $100. If it's a G, it's going to be about $115. If it's an F, it's going to be about $130 a month. So let's say G, which is where the majority of our clients are. The reason why it's as thorough as an F, but it leaves you with a Part B deductible. In exchange, you save a couple bucks a month. You basically save the deductible plus a little bit more by not having the Medicare Part B, by paying that Part B deductible yourself. So in addition to the $134 a month that you're paying with Medicare, excuse me, you're also going to be paying an additional $115 a month. So right off the bat, to get all your medical bills paid, you're looking at about $240 a month. I'm not looking at a calculator right now. Math was never my forte. My job is health insurance, not financial services. So if my math is off by a few dollars, forgive me. So you're looking at about $200 something a month. It's going to pay all of the medical bills. In addition to that, you are going to most likely need, or we very strongly recommend you want, if you don't have it through some other means like some VA coverage, a prescription drug plan, because Medicare supplements do not cover prescription drugs. So you're adding an additional $15 to $30 a month. So you're going to be looking to get full medical coverage when you add in what the government's going to be taking from your budget, what you would get for insurance, and what you would want for prescription coverage. And prescription coverage is kind of a different animal. It's going to be very specific to you. You're going to be wanting about, or looking at a bill for about $250, $260 a month on average. What you get for that is the bill paid. You also get, as this person, going back to the original question, I know I'm rambling, get used to it, I'm going to ramble a lot. You're going to be looking at the ability to keep any doctor. You will be able to use with a Medicare supplement any doctor, any hospital, anywhere in the United States that agrees to accept Medicare. Or, excuse me, that accepts Medicare. So you have no networks. If you need to see a doctor in the future, a specialist, say you come down with something, you come down with cancer. This happened in my family. Say you come down with cancer and you suddenly need to see a very good doctor that's out of your area that you had no inkling whatsoever that you would be needing to see. As long as that doctor takes Medicare, you will be able to use it with the Medicare supplement. And the supplement will work the same. So you can just go, you can just schedule it and go. Just make sure the doctor takes Medicare, you're good. So really what you're paying for is the elimination of the medical bills and the ability to use any doctor you want. Now, is that a trade-off? Well, this person's question was started off by saying they've paid a lot for insurance over the years. If $260 a month for you to have complete freedom of choice at doctors and hospitals, which by the way you didn't have when you were working, or excuse me, if you were under 65, you didn't say if this was private insurance or if this was insurance that you got through an employer, you didn't have complete freedom of choice. You either had an HMO plan, which requires you use doctors in their network, or a PPO plan, which doesn't require it, but it very strongly recommends it. Because with the PPO plan, you can go out of network, but they're going to charge you a lot more, plus you might have an increased or an additional deductible, and there may be additional costs associated with it, or it could wind up going into the co-insurance side of things, which means you're going to pay a percentage of what the cost is. up to probably an increased maximum out of pocket. So you really didn't have this complete freedom of choice. And I'll kind of go back into the what I just said there as some of those questions come back in. But Medicare supplements give you that freedom of choice to go to any doctor anywhere in the United States as long as they take Medicare. Really, in a lot of cases, that's what you're paying for. And you got to think about that when you make your decision about the healthcare as you turn 65 and go on to Medicare. Whoa, that was abrupt, wasn't it? Okay, so here's what happened. This is the first Q&A session that I'm doing, so I'm still working out a few bugs here. The battery on the phone was not fully charged, and apparently the application that's running this is more than the standard. I'm not using the standard video app. I'm using one that gives me a little bit better picture quality, a little bit more control over the presets, and it kind of sucked the battery down to nothing. So I recharged the battery yesterday, then redid the rest of this session, picked up where the first part left off. Well, for some reason that wasn't saved, and because it wasn't saved, I wound up having to redoing this basically the next day. So this is one day later than the first part of this question. So I'm picking up again where I left off. Yes, I put back on the same shirt so it's not too abrupt and everything, but it is a day later. So give me a second to get back in the swing of things. So we talked about Medicare supplements. Now, as far as Medicare Advantage goes, the reason why the difference there, a Medicare Advantage plan is a plan. You're still part of the Medicare program when you go into this plan, and you still got to pay the Medicare Part B premium. But the premium for Medicare Part B might be the only monthly charge that you pay. So if you're paying for something, if you've been paying insurance your whole life, you want to reduce a monthly cost, that's one way of doing it. Now, just because a Medicare Advantage plan doesn't have a premium doesn't mean you don't pay anywhere. What those are, you basically choose to opt into that company's terms and conditions of payment rather than the regular Medicare terms and conditions of payment. Now, if the first question you ask is, what am I losing? Well, by law, a Medicare Advantage plan cannot pay for anything less than what Medicare Part A and B would. And what that means is that if you're concerned about a particular operation, a particular service, Medicare is going to cover it. You're concerned about the Medicare Advantage plan covering it. The Medicare Advantage plan is required to cover it if it's something that would have been covered by Medicare anyway. So that part is not a concern. You're not actually losing anything by that. And by going into something with the lower premium, it doesn't mean that you're losing essential Medicare services. You're required to get those same Medicare services. But with Medicare Advantage, excuse me, with Medicare Advantage, instead of you paying a premium, or instead of you paying a high premium, instead of paying the $120 a month, they may have nothing a month, but it may actually have a premium, maybe $20 a month, $25 a month. It's actually not much of a deal at all, or not much of a big deal at all. Premium-wise, it's very low. You save money in that kind of a plan. But you turn around and you spend when you use services. So if all you do is go to a doctor a couple of times a year, with the Medicare Advantage plans, you actually only pay for those doctor visits and what the doctor may do to you. What happens though is if, or most likely when, something happens to you and you suddenly have to use more medical services, you fell on the ice, welcome to Ohio, broke a hip, wound up needing some heart surgery, came down with cancer, anything like that, you start using the medical services more, and each service, most services, tend to have a copay associated with them. Some of the copays are very low, but many of the copays do add up. For example, physical or occupational, rehabilitative therapy basically. Each time you see a therapist, you pay the therapist copay. So that cost can really add up. Now there's a cap on Medicare Advantage plans, every one of them. But the cap tends to be more than the average premium of a Medicare supplement. So that year you could pay more with the Medicare Advantage plan than you might with your premium with the supplement. The difference, the supplement is a premium. You pay that whether you use it or not, but that's pretty much all you pay. Maybe a deductible. Medicare Advantage, on the other hand, you don't pay until you use it, but when you use it, that's when you start paying, and there can be a little bit of a catch-up if you use it within a couple of years of the Medicare supplement. If you're kind of comparing the costs, you could catch up to that price fairly quickly. Now, the other thing, with Medicare supplements, you're paying that premium for the freedom of choice in terms of doctors. You can go to any doctor, any hospital, anywhere in the United States. As long as they take Medicare, they will take your supplement, regardless of company. Medicare Advantage, on the other hand, there's HMO plans and PPO plans primarily. There's some other types, but for the most part, in this state, they're HMO and PPO. An HMO plan means, except in emergencies, you're required to use doctors and hospitals within the network. PPOs mean you can go to pretty much any doctor or hospital you want, but if they're out of the network, as long as they take Medicare, of course. If they're out of the network, however, you will or could pay a higher copay and possibly an additional deductible if none existed on your current plan. So keep that in mind. The premium really does give you that choice of doctor and hospital. You can save the premium, but you do have to kind of play within a few additional rules and regulations. I'm not saying that's wrong. Don't misinterpret that comment as me saying you need to get a supplement, it's the best choice. That's not the case. It's just it's a different way of getting your health care, a different way of paying for your health care, and if you're okay with that, Medicare Advantage, by and large, is a fine plan, or is a fine program. You just have to be aware of those additional terms and conditions and restrictions with regards to it. If you don't want to play that game, if you don't want to play under that game, those rules and conditions, consider the supplement. An additional $120 a month, $130 a month is not a lot to when you're sick and you want to use any doctor you want.